Hello, everyone. Welcome to our webinar today. We're really looking forward to speaking with you all today on how we are transforming patient and clinician experiences with care at home. I'm here with colleagues from Geisinger Health, and we'll be speaking about their program and how they leverage the Best Buy Health platform. So let's get started. First, with some introductions, my name is Lauren Levinsky. I am the Chief Marketing Officer at Best Buy Health, and I'll have Emily and Anthony introduce themselves. Emily, how about you go first?
Sure. Hi, Lauren. And hi, everyone. I am Emily Fry. I am the Vice President of Innovation Operations at Geisinger.
And I'm Anthony Wiley. I'm the Senior Medical Director of Geisinger at Home, as well as our Acute Hospital Care at Home program.
All right. So before we jump into too much content here, we're going to just ground everyone a little bit in what our organizations do so you know how we are coming to care at home and our different perspectives. So first, a little bit about Best Buy Health. You all probably know Best Buy as a consumer electronics company, but at Best Buy Health, our purpose is to help enrich and save lives through technology and meaningful connections. We know that technology is moving into the home, and technology is moving into health, and then also health is moving into the home. So with those two things, our goal here at Best Buy Health is to enable care at home for everyone by bringing the technology they need to stay healthy into the home. And we really do that in three different areas. So we want to interact with consumers, healthcare consumers across the spectrum at all points in their life where they are looking to either from getting well to staying well. So we interact with patients when they're looking to stay well at home. So really enabling them to manage and improve their own health conditions with the things that you all know Best Buy sells, like Fitbits and blood pressure cuffs. But then we also support these same consumers as they move along the acuity spectrum, and we help them age at home. So we'll have solutions that enable seniors to age confidently at home. So that's everything from fall detection services or technology, but also the services they need, social care services, to make sure that they have what they need to stay independent at home. And then what we'll be focusing on today is really our care at home solution. That's where we enable healthcare organizations to deliver care outside of the hospital. And that's with our Current Health platform. And all of our solutions at Best Buy Health are really enabled by what Best Buy does best, the power of retail that they bring into healthcare to help with the hard things like the logistics and supply chain that we know is becoming even more problematic as we move outside those four walls of the health system. We also have Best Buy is able to provide kind of that support that they provide on the technology side for patients as they're receiving medical care. So that's either in home, in the lobby of a hospital, or even in the store as they go looking for at the beginning of their wellness journey. And with all of that, we're really seeing at Best Buy, how are we meeting those consumers at an earlier point on their healthcare journey by meeting them where they are as they're looking for wellness solutions. So that intersection of kind of the consumer and retail. So that's all that Best Buy is bringing to health. And what we'll really be focusing on today is the Current Health platform. I won't do too much here because this is what Dr. Wiley and Emily will be talking about, and how Geisinger is using the Current Health platform to provide their care at home across the spectrum, from chronic condition management all the way to acute hospital care at home. So with that, I'll turn it over to Emily to introduce Geisinger.
Great. Thank you very much. So as you can see on the screen, Geisinger is based in the Northeast region of Pennsylvania. We are committed to making better health easier for over 1 million lives. Geisinger was founded over 100 years ago by Abigail Geisinger, hence the name. And the system now includes 10 hospital campuses, a health plan with more than 500,000 members, a research institute, College of Health Sciences, as you can see on the right-hand side, school of medicine, nursing, graduate education. We have over 25,000 employees, 1,700 employed physicians. And the one thing I really love, just personally working about Geisinger, is just how much we are embedded into the community. And within being embedded not only as a healthcare provider, we're one of the hometown economies, boosting the hometown economies in Pennsylvania by billions of dollars annually. Both rural and urban populations we're serving, which I think is an important point as we talk about our care continuum strategy in how we're trying to reach our patients in those rural areas and also addressing them in our urban areas. And I'll apologize for my voice. I am getting over an illness. I want to address it for everybody. But yeah, that's who Geisinger is.
Thank you, Emily. And 'tis the season for hoarse voices and congestion, but appreciate you being here with us today. All right. So before we dive into the Geisinger experience with Care at Home, we did want to kind of ground the conversation in some recent research that Best Buy conducted. So we published, and you can find it on the Current Health website, a report called Clinician Perspectives on Care at Home. And this was a research with over 100 clinicians across different specialties and areas of practice, different hospitals, but a lot of mostly with kind of health systems and academic medical centers of kind of 100 physicians or more. But we really wanted to understand from those organizations their perceptions of Care at Home. So, we all are doing these programs, but I think it's really important to understand the clinician perspective of those who are not as close to the operations. And so what we'll kind of start the conversation with here is looking at the research and getting Dr. Wiley and Emily's perspectives on the research to kind of give some context for an organization who is pursuing this. So just to kind of note, I will say that most of these respondents are doing some level of Care at Home. So it's not that they are actually quite familiar with the programs, but it would range from just virtual visits to we asked about chronic disease management or hospital at home. And actually we saw that almost half of the respondents are doing hospital at home and almost 2/3 are doing some chronic disease management. So when you think about the results of these programs, it is folks who are pretty well versed in what Care at Home is, knowing that Care at Home, as Emily and Dr. Wiley will talk to us about, it's a big spectrum of a lot of different things it can mean. So first, one of the questions we ask is really around the positive impact that Care at Home can have. And we're seeing across the board that clinicians are super optimistic about what Care at Home can provide for patients, and somewhat themselves, but they certainly prioritize the impact on patients above their own. Now we're seeing access to care as well as patient satisfaction and engagement as kind of the top drivers of the positive impact these programs can have. So would love to hear, Dr. Wiley, maybe start with you. When you look at this list of the positive impacts that these clinicians are noting, is there anything you would add to the list? Anything you'd prioritize about your experience at Geisinger?
No, I think that this actually really kind of aligns with what I would expect. So I think first, it's inherent in physicians, nurses' nature to kind of put the patient first, right? So I think that has a lot to do with why the nurse and physician satisfaction is actually towards the bottom, because we really care about our patients and the outcomes of our patients. And I really think, access is one of the biggest keys, right? We know that there's a national shortage of clinicians, and the more that we can bring that care to the home, and again, this is to your point, there's a very expansive, encompassing spectrum here, right? So it could be kind of telemedicine with video. It could be telemedicine with someone coming actually to the home to help the patient perform video visits. It could be a clinician coming to the home. So it's a wide range, but I think the key really here is the access piece. And what we've really seen is, that improved patient engagement, that improved satisfaction. Myself personally, as a clinician who does this work, I see this every day whenever people are letting us come into their homes, just the level of being appreciative, because otherwise they wouldn't have been able to seek care elsewhere outside of an emergency department.
Thank you. Emily, from the operational business side, is there anything that does the rankings here change for you? Or, if you're going into a business meeting, what is the one thing that you would really call out as the key impact of Care at Home?
Yeah, I think, to Dr. Riley's point, the patients first. And so their access and their satisfaction and engagement is the priority. From an operational benefit, I'm not surprised and agree with the reduced healthcare costs over the higher revenues, right? From a value-based care perspective and lens, we're not looking at this to be a fee-for-service model, really generating and billing for these services in the traditional way you think of. It's really looking at how do we reduce your utilization. And so from the operational perspective, I think agree with the order and the percentage that are shown here. I would say the clinical outcomes too, a little bit harder to quantify, But what I'd love to figure out and study here at Geisinger is how do we attribute and associate some of those downstream effects that come from or I would say unanticipated clinical outcomes, whether it's the engagement in the home and solving for depression, or those social isolation factors, which are clinical outcomes maybe not attributed to our hypertension program. So examples like that, I'm excited to continue to study and the impacts. So I would definitely rank that up there, because it's not just the single condition we're noting, it's some of those multiple factors. When you start working with them in their homes, it's inherent that you start embedding into their day-to-day lives. So it's different than going in a once and done visit, acute visit. So yeah.
That's some great color. Awesome. Thank you. So you guys both touched on the providers putting their own needs kind of at the bottom, the benefit of care at home for themselves. But I think we asked a separate question about likelihood to recommend. And we know that there's overwhelming endorsement of these models by the respondents here, both would they recommend to colleagues and peers to kind of participate and work in these models, as well as family and friends. So, as a patient, kind of be open to receiving care in this way. So obviously very positive. I think I've seen some of your NPS scores, and I know that you guys are seeing some of the same kind of positivity in the programs. But I also know that across the board, one of the kind of biggest barriers we see is provider buy-in to kind of refer to these programs. And that's something that every program we work with has to kind of get over this hump of making sure people understand what care at home is and can know to refer into the programs, and also trust that the programs can take care of their patients in the way they want them to. So how do you reconcile this high level enthusiasm with probably the barriers that you've probably experienced around getting broader buy-in for the programs? Dr. Wiley, do you want to go first?
Yeah, sure. I think that I look at this, and obviously, you mentioned at the beginning that many of these folks who responded are doing this work, but I do think that this bodes well for the future of care at home programs, and across the broad spectrum of chronic as well as acute care. I think a lot of this is going to come down to really proving ourselves, whether that be on the healthcare delivery side, the technology side, really demonstrating, really proving that we're increasing access, proving we're increasing, efficiency, satisfaction, and outcomes. And I'm really hoping that this becomes, the new norm.
Yeah, I think right now we are developing the best practices and the standards of care, and our consumers are seeing a positive impact from that through this data. And to your question on how to address the barriers, consumer expectations become what drive change. So I'm excited to see this as we look at the natural progression in the future and driving the expectation from our consumers as they go into the hospital to get into these hospital at home programs. When they start adopting and asking for more of it, it will drive federal change. It drives our friends in the non-norm industry, healthcare industry players like Best Buy Health start to push into these spaces more, which then push healthcare organizations to force change. So I think there's a domino effect, a trickle effect when we have positive perception and positive engagement and outcomes like this. So, I think like anything, it takes time to prove out, and the technology, as Dr. Wiley mentioned, the care model, most importantly, I think those are the pieces we're really refining and working on. Technology as an enabling, but how do we build those care models from a comorbidities review, as well as at a singular condition level, and then these expectations will continue to push and drive more adoption.
Great, thank you. All right, now we're going to talk about kind of clinician experience and a little bit about the Great Resignation, which is unfortunately not an overused term. It is an overused term, but it hasn't gone away yet. So in our survey, there's a lot of talk about this, but our survey at least saw that 33%, a third of our respondents, had thought about leaving their role in the last 6 months. And a lot of them are thinking of moving to similar organizations, but of those trying to leave, 20% were looking to just leave healthcare entirely, which is absolutely not what we need at a time when we have staffing shortages to begin with. That said, I think we're seeing so much positivity around care at home, and 70% of respondents saying they would be interested in participating and working in one of these programs. So I would love to understand how Geisinger thinks about their care at home programs in terms of staff retention at a time when we need every clinician we can get with everything that's going on.
Yeah, I mean,
Go ahead, Zach.
I'm sorry. When I see these numbers, I find it very, very encouraging, right? That there is a higher level of interest into this work. I will say that, home-based care from a physician perspective isn't for everyone. It took me a while to adjust for this to be my personal practice. But the way we're really approaching this, we've been very fortunate. We actually have, the majority of our advanced practitioners have actually been here since the inception of Geisinger at Home a little over 5 years ago. And so we've actually been able to retain those folks. I think one of the biggest areas that we're focusing on is the exposure at earlier stages in medical education and in residency to these models of care, right? So, we have a steady rotation through our medical college where they kind of pass through in their third year and spend some time with us on the road, doing virtual visits and actually spending time with the entire care team. We actually do the same thing with our internal medicine residents in hopes that, models like this, whether it's within Geisinger or outside of our organization, there's a higher awareness and, maybe a little bit more enthusiasm, right out of training to do home-based care.
I think the evolution of our virtual health, following the traditional telehealth and through COVID changing into this virtual health model coming out of COVID, we've seen a number of technologies allow us to adopt remote workers from a clinical monitoring, clinical partnership level, whether that be, into the inpatient setting or into a patient's home. And I think it's really exciting to think about, even with not only the great resignation factor, but the aging population that we have as a nation. And, I am not a nurse, but I come from a family of nurses. I have a number of family members and they are the most passionate people. And not to say, not to say Dr. Wiley is not just as passionate, but they would love to work beyond the years that they likely, with the intensity of the work, 12 hours a day on your feet, it becomes to a point where it's not sustainable in the inpatient setting. So, it forces people to retire whether they want to or not sometimes. And so there's an opportunity that it's provided us to leverage those people who are still passionate, still want to work. So I think there's other factors here too that are also, we're able to leverage people and retain not only from a satisfaction level, but creating opportunities for those who didn't realize there were other ways to do nursing or to do physician oversight or a higher level provider in a different way that's less intensive on the body.
I love that. It's not just about retention, within the years that they were intending to work, but it's expanding the amount of time that they could first, feasibly stay in this role by giving new opportunities. And Dr. Wiley, I think there's such an interesting conversation around just medical education and getting folks into these programs earlier that I'm really excited to see happen over the next few years.
Yeah.
All right. And then challenges. So I think I would love to tee up the rest of our conversation a bit with this slide. So we see the top challenges here being kind of tech support and logistics support. So I know you are both going to speak to kind of what you are doing as part of your current program to overcome some of these challenges with Best Buy Health and Geek Squad specifically. But I'd love to just maybe set the tone for why these things are so challenging in healthcare, especially as you move outside of the brick and mortar. Like, what about the tech support is so different when you go into the home, and the logistics are so different when you move into the home, that this rises to the top in terms of a key challenge?
I mean, everybody's home is set up different. We're not in standard set rooms, right? So there's your number one, I'd say. We don't know what the setup is in the home for the patient, and sometimes the patient doesn't know. It may be set up by somebody that just did it for them years ago, and so there's a learning curve with that. The getting patients to adopt and engage is another critical item. And without really walking through things with them, ideally in person, making sure that they understand how to use the phone, how to use the devices, you're likely going to get inaccurate readings. You're going to not get as high of engagement in messaging and knowing when or how to respond to messaging. It's very easy when I download an app to say, do not allow notifications automatically, right? This is one of those cases you want to allow notifications because we're talking about your care. This is not your Twitter feed or I guess X feed now, but those type of examples. So I don't know, Dr. Riley.
Yeah, no, it's so we have a very interesting geography. We have a combination of kind of urban, suburban, and very, very rural. And so first, just identifying what connectivity options do we have, whether it's cellular, whether it's Wi-Fi or Ethernet. That alone has been just an inherent challenge for us. We've had, and also, Emily mentioned the home setup, and I've had some very personal, interesting experiences in trying to, find where is the router, and so those alone are challenging. And I think that's why having some dedicated, technical and logistical support to this is so key. The other piece, one of the things that we really strive to do is to, sometimes be the introduction to technology to an aging population or to a population that otherwise hasn't been exposed to it. And so I think that the ability to be in person, take the time, walk them through kind of each of the steps, just really, as opposed to saying, here, download this, right? This is, sometimes we have to set it up to the point of, setting up an email address even, or teaching someone how to scroll. The other thing that I think is really important, and this is more, I think, on the doctor side of things for me, is really like, one of the challenges with any sort of remote monitoring or biometrics in the home is, what do we do with it? And how do we not make it disruptive to our day? And I think that speaks a little bit to the physician buy-in piece. And so having, a dashboard that is easy to use, that has, mobile app support, that we can look at on the go, whether it's in an office or in my case, going into the homes, is extremely helpful. And the other piece is, having it set up so we know what to do with it, right? This information is great. And we'll talk a little bit about that, I think, a little bit later. But sometimes it's a challenge of saying, well, what do we do with this information? And so those, I think, are some of the very overcomable challenges that we kind of face with this work.
Cool. Well, with that, let's get into your program. But first, I think before we have you describe your program, we want to hear from a patient who has benefited from your care. And I'm really excited for everyone to meet this patient. She's one of my favorites. I bookmark her whenever I'm having a bad day. So we'll pause for a quick video. I'd like everyone to meet Marge.
My name is Marge Austere. I am a widow of 52 years, and thank goodness for this monitor, I am alive today. Geisinger knew there was a problem here. They had called my daughter. She came here, and she found me sitting in this chair, and I wasn't talking or anything, and right away she knew that was not me. And they took me to the hospital. And I was there for 3 days without knowing anything. My daughter showed me a picture of my husband, Frank, and I smiled. He brought me back, and here I am. And I'm able to talk about it and smile about it and be happy. Modern technology is great. Because I had this, they know everything about me. Let's put it that way. Michael, gosh bless him. He came here one day. Oh, he explained everything. He knew everything.
All right, so we have the app installed on your phone now.
It says right here, these are the things you do today. And then you scroll it up here. See, I learned that too. And then here you get, your weight. Don't look at that. And this is the oximeter. This is the pulse rate. And this is blood pressure. If my pulse was down, they would call me. I'll tell you, I was never alone. And of course, I found out Geisinger has people too that will come to your house. I love it. I don't have to go outside the door. They call the doctors and talk to them.
I could reach out to the Geisinger at Home team and see if your results came back.
I am 89 and I am still here to enjoy life to the fullest. Why? Because of the care and my miracle worker.
I'll let you guys take it away from there. I love
Yeah.
that video.
Gotta love Marge. So, we she did a great job overviewing kind of what we do. It's it's hard not to feel really good about what you're doing when you see those examples. But we call our program the Connected Care 365 program. And ultimately what this is the infrastructure, managing the care model design we discussed earlier, and then the deployment of the technology across the organization. So that means, what are the device standards we're using? What types of devices do we have accessible to the organization based on, are they FDA approved? Are they not? And where can we use them? What populations? What conditions? So the Connected Care 365 infrastructure is helping manage that. And then additionally, there's team members who are partnering with different areas in the organization to ultimately build out those care models, the clinical protocols that are required to engage our patients safely and ensure the best outcomes possible. And partners like Dr. Wiley, who you're going to hear from, he's our medical director over a couple of our delivery models that we have within the Connected Care infrastructure. And the vision at the end of the day, not to read the bullet points, but I'll just, skip down, is really ensuring the right patients are managed at the right time with the right service level, with that being, those things I mentioned, the right team member, the right provider, the way they want to be engaged with what devices make sense based on their condition or state, and at what acuity level that is required. So that is the vision of this, and it's not easy. I'll tell you that. I think there's many great organizations, if you're listening and you're one of those that are doing this and really paving the way for how remote patient monitoring and care at home can really make a difference as a secondary model outside of the traditional brick and mortar. And so that's ultimately the overview of what we're trying to achieve here. Next slide. So I mentioned delivery models. These are our delivery models that we have today. They are working in concert. So we pulled out a couple of them as an example, but and these are the two actually that Dr. Wiley is our medical director over, which is critical to success. Our hospital at home program and Geisinger at home program. We have our chronic disease management command center, which is our lower acuity and has a hybrid model of oversight. So you see that top circle, that is the lowest acuity patients. So thinking about your hypertension programs, your diabetes programs. And then we have our case management team who is significantly involved in our remote patient monitoring programs and overseeing the many disease states that are in this. Why don't I hand it over, because these are programs you see and manage day in and day out. Dr. Riley, you want to talk a little bit about Geisinger at Home and Hospital at Home too?
Yeah, sure. So, our Geisinger at Home program is what I would kind of consider a hybrid of both chronic care as well as acute care. So we do everything from what people would consider to be primary care at home down to essentially hospital to home level of care without necessarily calling it that. Those folks are enrolled in our program anywhere from 1 to 9 months or potentially longitudinally. And in that, we actually monitor our own patients. We have our own intake center and team of nurses that actually monitor triggers, reach out to patients, and whether it be via the mobile app, whether it be via telephone. And then those, so that's one component of this work. That's actually been around now for almost 6 years. And we've actually enrolled, over 15,000 patients into our model of care. We usually carry a daily census of close to 2,300 patients, across 15 counties. Our acute hospital care at home is our newest model, and it says it right in the name. It's a hospital at home model of care. This is a little bit different because we actually leverage the clinical command center for our off hours monitoring. And that's one of the things that I think makes this model unique is that true 24/7 alerts, that 24/7 oversight that we provide with partnering with the clinical command center, which I have to say is just immediately integrated as part of the team in morning huddles. And we've had a few patients to say that how much they've felt comfortable when they've actually gotten a call in the middle of the night, feeling as if they know that they're being watched, they know that they're being monitored. So it's carved out as a separate model of care. But as we kind of see in the next couple of slides, our patients can definitely kind of move back and forth between the models. So I think we might want to be able to go to the next slide.
Well, hold on one second. Sorry.
Sorry.
So the only thing I'd add here is, so you said it, right? We'll talk a little bit about the complement, like why we have them from a step down or step up through the acuity level of services as necessary. I think the other thing I'd note here is, why do we have all these different delivery models, right? It is important as we think about who is managing what, and I talked a little bit about this before. You're looking at opportunities by condition, you're looking at them by population sets, and you're looking also at by quality cohorts. So, Geisinger at Home is a specific population set, which is managed by our health plan. Then our chronic disease management command center partners with specialty, and it's more of an all payer, but has a hybrid model working with nurses who are in those specialty clinics, as well as a command center who's overseeing it. So I think what I wanted to highlight here is if you're building a program out like this, being able to have the flexibility to know that it's not going to be a one size fits all. Like, you're not going to be able to necessarily have a singular, maybe you will. I shouldn't say it with such a matter of fact statement. Maybe you will, but the hybrid model of managing the oversight of the monitoring has worked really well for us based on those three factors, right? What conditions we're managing, what level of acuity and population we're talking about, and then ultimately really looking at the quality cohorts, which I think crosses those condition and population sets. And so the quality cohorts, I'm referring to like readmission avoidance, your ED utilization management. So those are things we're looking at.
Yeah, and I think that's a really good thing to point out. We have very specific populations for each of these models. Although patients can sometimes be in, many of them across their journey, there's
Right.
very kind of defined kind of reasons or defined volumes of condition or utilization that kind of will pull people into these models of care. And to your point, especially our Geisinger at Home model is really kind of focused around our health plan patients and really value-based care. Whereas some others are more of a specific payer or all payer model, depending on which model of care they are.
Yeah. So next slide, I think to your point, Dr. Wiley, the transitioning across the acuity level is necessary. So he noted that, oh, sorry, there's a big echo. He noted that Geisinger Home's been live, you noted a huge cohort of patients that you've managed over that life cycle. We've been working with Best Buy Health for, I think, over 2 years now, really ramping up as of last year. But Geisinger's been in the RPM game for many, many years. And I think that's really something I want to highlight here as an innovative thing that when I came to Geisinger was really impressed by. We have really transformed our model into what we're talking about today over those years, but we've served over 27,000 patients with the ability of using remote patient monitoring over the course of, I'd say, almost 13, 15 years now. So quite a bit of time. and as it's evolved, we've built out those clinical programs that are harnessed or built within 4 delivery models, the delivery models we talked about here. So I just wanted to highlight that, but maybe Dr. Riley, talk a little bit about those transitions across the different levels of acuity.
Yeah, and I think that, depending on the patient profile, depending on the volume of chronic conditions, depending on the acuity, as we highlight here, our patients can really kind of spend time in each of these levels, sometimes scaling, up or down, going back and forth between models of care. And, we've had some really good experiences in, remote patient monitoring, actually driving that and helping us kind of create that handoff or support, potentially a handoff from hospital at home to Geisinger at home, knowing that we can do that a little bit sooner because we continue continuous remote patient monitoring on that patient. I think our lower acuity is a little bit more focused on that kind of exacerbation prevention, is a little bit more intermittent monitoring based and kind of monitoring disease progression. But the other thing that I'll kind of say to this slide that I think is great is, we can kind of escalate and de-escalate the dosing or the model based on the acuity. But when it comes to the remote patient monitoring, we can also add and subtract devices. And
Right.
that actually allows us to step up from intermittent monitoring to continuous monitoring, depending on, going from the lower acuity, a hospitalization, and into the home-based, kind of acute care model. We're actually adding devices to that because we know that we need to step up the level, not only of the acuity of the care, but also the acuity of the monitoring that takes place. And we've been very fortunate to kind of, as we've grown in our relationship with Best Buy Health, to really kind of learn from that and be able to do that, I think, more and more seamlessly as that partnership grows.
That's the goal, that seamless transition across. We're all, I shouldn't say but there's a lot of folks out there. The rate of chronic disease is doubling and just growing substantially. So the number of people that are going to experience those low to high acuity events is pretty significant. And so how do we make that experience as seamless as possible for you when or if you need those transitions of care? It's a stressful time already. We don't need to make it more stressful by having it really clunky. So it's an absolute goal for us to make this a very seamless program. Thanks. Sorry. So I think, there's a lot of opportunity, but what this slide is showing you is where we've come in the types of devices we have, and the types of biometrics we're reporting. I'll just I work in the Steele Institute for Health Innovation, where we define innovation as solving a problem with quantifiable outcomes, fundamentally different with quantifiable outcomes. And that quantifiable outcomes piece is so important to us because we need to measure and monitor our performance in what we're doing. And so making sure we understand, we build a protocol at the beginning of a program, and there's iterations to that protocol. You're never going to build the clinical protocol, and Dr. Riley can add to this. When you're building a new landscape, in this work, you have to build a protocol, and then tweak it based on the data you're getting. So our hypertension program is an example, like the amount of data flowing through that Bluetooth blood pressure cuff and the amount of alerts that the provider, the specialist needed to review and manage the care appropriately. We learned and really set parameters and change those clinical protocols based on those reportable biometrics. And when it's appropriate, and I say this, it's not always appropriate to have continuous monitoring. And so understanding when it's appropriate for continuous versus intermittent monitoring, and what devices are the right. So back to that, in the very beginning, meeting the patient with the right take care team member with the right technology and care model is really important to us. And so just to highlight here, we have a number of different ways we're doing that. Anything to add, Dr. Riley?
Yeah, I mean, I think as you can see here, there's a lot of devices and a lot of biometrics, right? And so, one of the other problems we are solving is, what do we do with this, right? How do we visualize it? And to your point, how do we kind of use it to understand who the right patients are? I think to Emily's point, for continuous monitoring versus intermittent monitoring, how long you do it for, what are the highest value, kind of the highest value data, and then and then I think about how that can impact efficiencies, right? We get some of this data upwards of every 15 minutes with continuous monitoring. That's a lot. And so do you always need that? How do you kind of use that in the right patient? The other thing that's really nice about this data, I will say, is that it's integrated into our medical record, and it was done like really efficiently and very quickly. And so, being able to compare remote monitoring data versus office vitals or home-based vitals has been really kind of key, because it gives you just a bigger picture of what's going on with the patient. I think the one thing, and it just a really kind of, I think, a great example of how it can improve efficiencies, just on a very anecdotal basis. I kind of reference a patient that we had a few weeks ago that, we took out of the hospital on 6 liters of oxygen as a new oxygen start. Our hospital home team currently does not have respiratory therapists. And so we kind of had to say, we want to wean you from your oxygen. We really leveraged, a couple of the specific biometrics, right? The activity. So knowing how much that patient is moving around down to the number of her steps, as well as the continuous pulse ox, really allowed us to actually wean her down from 6 liters to 2 liters over the course of 2 or 3 days, really without ever having to leverage a respiratory therapist, because we could see how much she was moving and what that did to her oxygen levels. And so she felt confident that we were able to do that. It, kind of did not necessitate deploying extra staff. So it certainly helped with our efficiencies, because that allows us to get to more patients faster. And so I think that that's just an example that, taking all of this data and incorporating it into the work that we do each and every day.
Next slide. So, we engage with Best Buy Health as our strategic partner. I mentioned that. I think it's been over 2 years now. Actually, more than that, because we were engaged in COVID. So I think we're at 3 years now. And one of the things as we were evolving, and go back to that data slide you had shown around like the barriers, like access, tech support. I think that slide perfectly exemplifies the why search for a partner like a Best Buy Health. And we knew that engaging in a logistics, and like we're a healthcare organization, we're good at building those care models, we are good at caring for our patients. We're not a logistics company. We can't compete with UPS and the delivery services of mail and how to even manage that well. And also, how do we, get in the homes as quickly as possible? So that's, what I'm building up to here is why we engaged and had also, we were one of the first pilots. We were the first pilot partner in working to build out what does it look like to have Geek Squad come in your home, and what's the appropriate model for in-home Geek Squad care management. So I think, just to highlight my former boss, Karen Murphy, we knew that healthcare was changing, and we wanted to partner with those that were like-minded and had the same values and mission to that were non-traditional players. And so there was born the Best Buy Health Geisinger partnership. And maybe Dr. Wiley, you want to speak about the Geek Squad engagement and the pilot? You lived it day to day.
I have to say the responsiveness of the team, it really helped us with efficiencies, because we had folks who were going in there, specifically trained to do this work. And also really I have to say, really trained on being empathetic and being very caring in the delivery of this. So it wasn't just tech support. It was also, again, in a way addressing some social isolation. But it certainly helped with just it helped our own internal logistics, our turnaround time. It moved, as you'll, I think, see in some statistics here.
Yeah, maybe go to the next slide.
Yeah, I was going to say, it actually really improved as you can see here, the how quickly things were activated, as well as by being able to get more folks on it reliably, being able, I think, to have that person-to-person education in the home, and the true taking our time to set up. I think that patient adherence piece was really, really big for us. And those were some of the things really that I noticed was more folks actually activating and more folks actually adhering to wearing the device and doing the tasks that we set out for them.
Yeah, I think just one last note. I love to do secret shopping. So a few weeks ago, I did some secret shopping on this, right? It's been over a year we've been doing we went from pilot to just mainstay operations of Geek Squad. So wanted to test that out of pilot phase, we were still holding true to our parameters, and in that fast time to activation, what was the experience like? So that individual actually in that picture on the screen came to my mother-in-law's home and did it within the turnaround time required. So the SLA was met. He was wonderful. He took, I asked a lot of questions, acting like I didn't know what I was doing. And he took so much time and care. I mean, he was with me for 45 minutes. So, I stretched it out to the dramatics, but they're willing to take that time with a patient to be able to make sure they are fully activated. They fully understand. So I know I'm an N of 1, but this data here speaks to a much larger N. And that was during the pilot, and we're now out of pilot phase. And in my secret shopping experience, we're still holding true to those numbers. So I think that's really cool. I think that's it for our model, right, Lauren?
Yeah.
Okay.
Awesome. Thank you. I'm going to speak a little, before we turn it over to Q&A, I'm just going to kind of give a little bit more background on what we're doing with Geek Squad as we move, as Emily and Dr. Wiley said, out of pilot, kind of bring this more broad at Geisinger and elsewhere. Just to kind of ground people in what else Geek Squad, what we're doing today and where we're going. At Geisinger, they spoke to this in-home setup model that we have. So we're actively doing this with the current healthcare at home platform. We also have experience with installs around personal emergency response systems, so supporting kind of fall detection with seniors in the home and making sure they have, the confidence to use that technology as well in the same way, it was described at Geisinger. Going counterclockwise, I guess. I think Dr. Wiley said, or maybe Emily said, health systems are not logistics companies. They can't compete with UPS. Geek Squad and Geek Squad City can. That's what they're built for. So Geek Squad City is the kind of processing plant in Louisville, Kentucky. It sits on the UPS line, and that's why Best Buy is able to kind of do the logistics better than almost anyone in the country. And when it comes to timely access to care, it's just absolutely critical to have that scale. that they have. So we're really excited that we've, in the last few months, brought all of our, health processing in-house with Geek Squad City. And just one of the reasons, as Current Health was acquired, why Best Buy made sense is to be able to take on kind of that logistics and supply chain that health systems don't want to deal with, and you really need the scale. What we're trying to do next is really make sure that we can we're meeting all our SLAs from Geisinger, as Emily said, but we want to be able to do this faster. I think there's a lot of times where with these care at home models, especially as you go up in acuity, the timeliness is absolutely critical. And as these programs grow and there's more scale, we know that this local reprocessing is something that we need to be able to provide to get this turnaround time even faster as health systems grow these programs. And then also another thing we're looking into with Geek Squad is we want to be able to manage enterprise IT systems. Let's take this burden off of your IT teams for things that are not specific to care at home necessarily, so that your IT teams can focus on the things that matter most. So we're our team in Louisville, Kentucky has over 450 agents. They customize solutions for organizations that are twice as big as Best Buy, and they do things like inventory management, storage, provisioning, kitting, shipping, device repairs. So they're able to support enterprise IT, and we're seeing the ability for Geek Squad to be able to do that more and more. Dr. Wiley and Emily spoke to kind of the folks that are our agents that are on the ground, and not only are they trained in how to use the technology, but they are trained in empathy and customer service. I really have met these agents, and to them, it's more than a customer service job. This is or more than a tech job. It's really about customer service and empathy and just human touch, which is something that you really need to pair with the technology to hit the adherence goals, and just make sure patients feel seen and heard, and the 45 minutes you spend with them is so critical. So lots of training there on the empathy side, in addition to obviously all of the HIPAA compliance and things that you would expect with agents going into patients' homes. And so when we think about Geek Squad and where they can help, I think I like to think about these 4 areas. So it's access to technology, and I think it's timely access to technology. So it's not just the fact that Best Buy has all of this tech. It's to the point, I think Dr. Wiley said, it's the right technology at the right time in a patient's care plan. And how are you able to make sure that they're using the right technology to give you the information at that point in their journey? So getting access to the right technology, getting those patients trained on how to use a technology to interact with their provider in the right way, getting them logged into MyChart, into the system, all these places where the education from the get-go is really, really important, all impacting adherence. And I think one of the things that I think is so important is Geek Squad agents' ability to instill confidence in these patients, that they know that they're using the technology right, even if it doesn't feel right. I think we've heard stories of patients who feel nervous they're going to break something or they're using it wrong. And all it takes is some assurance from someone who they trust, who knows how to use technology, to make them feel like they know what they're doing. And when they feel confident, their adherence will go up. And that's better for health. That's what's going to impact health long term. And then also IT operations. Let's take, some of these basic things off your IT team's plate so that you can do the hard jobs and the things that need to get done to serve patients. And I think the best thing about when I think of Geek Squad is they are wherever the patient is. So we're really thinking about patients across that entire continuum of their journey with their health, from getting well to staying well. And we know that there are Geek Squad agents kind of along that entire journey. So whether it's when they're searching for a blood pressure cuff in a Best Buy store, or maybe leaving the hospital after a condition being diagnosed with hypertension, or in the middle of their care journey when they're trying to troubleshoot something, or when they're out kind of living their lives in their communities. So with Geek Squad, we see a huge opportunity to be able to meet those patients where they are as technology is moving into health, and health is moving outside the 4 walls of the health system. That's where we think these Geek Squad agents who we've had a privilege of being able to pilot and prove out their capabilities with Geisinger really can make a difference. So we're excited to see kind of where we can take this and welcome more conversations there around all the things that Geek Squad can do. So with that, I think we're going to turn it over to some Q&A. I think we have a few minutes and a few questions that have come in. So the first one is, we spoke a little bit about buy-in, but I think we're looking for some specifics about how Geisinger has really gotten physician buy-in for your care at home program. So any tips and tricks for how to really get providers bought into the program?
I can speak that a little bit. It's been a lot of hard work. I'll admit, and it's still a work in progress. I will say we've had a lot of success right out of the gate with our hospital home program. The hospitalist buy-in, the specialist buy-in has been great and I think some of that actually goes to us setting the stage for the last 5 years with our Geisinger at Home program. We act as a collaborator with primary care and specialty. And so it's just taken a lot of communication. And honestly, it's come down to proving ourselves. It's, and that is really on a patient by patient basis. When they come back and the patients, kind of speak of the work that our nurses and our advanced practitioners have done in the home, and they see that, the result, the patient's either doing better, they've had an intervention in the home, over time, they start, that's how we kind of get to that buy-in, I think, of care at home programs. So it's been really proving ourselves. And I think that we've actually come down to the point where, this idea of collaboration with primary care and specialty care is a integral part of our vision statement for Geisinger at Home.
Next question is around enrollment. So it's probably specific to each of the programs, but what is your enrollment process? Is it physicians pushing patients into programs, or do you have dedicated teams that are pulling patients into them?
Yeah, so that's why I was shaking my head when you said it's by specific program. It's different. But I will say, overall, we do have embedded Epic processes. So, we're an Epic shop, so embedded referral processes for the physicians to be able to push them into the program where appropriate. We also have some monitoring and reports that can identify patients that would be eligible for programs. Commending our case management team is piloting right now some models using AI to make some identification based on utilization risk and other things to really push them into the review for appropriateness into the programs. So, and that's care at home overall, not specifically RPM. But I think for our RPM programs, we have Epic referrals that are built, and it's a hybrid model, and I think it will always be that way. It's never going to be one way or another. Dr. Wiley, that's pretty true, I'd say, across the spectrum. It's hybrid. It's not like one of them is only one way.
Yeah, I would say I don't think it's quite a 50-50 split, but we get, in our models, especially Geisinger at Home, and I'll speak mostly to that because of the volume. Between care managers, primary care doctors, specialists referring into the program. But then we also, have identified, as Emily kind of pointed out, based on kind of a patient profile of chronic conditions, utilization, et cetera, kind of a list and a list of 6,000 plus folks that are still eligible for our model that we get to on a more proactive basis. So I think it really is a combination of both. And I think that's important as anyone kind of building a model like this, because you want to get to as many folks as possible with this type of care. And so I think that relying on just one or the other, the best approach is really kind of getting at both.
Awesome. That's great advice. All right. Well, it looks like that's all we have time for today. I want to thank you both for joining us. I really appreciate you sharing your story and all the work that you've done. It's great to hear, and I hope others learn from it. Thank you, everyone, for joining us today. And please reach out if you want to continue the conversation or have any questions. Have a good rest of your day.